Four herbs can help reduce symptoms, duration, ease irritation, and support minor infection control if used correctly. Hi, I'm a combat medic veteran, a family nurse practitioner, and fellowship trained in integrative and complementary medicine through George Washington University. This is part 2 of the 12 Herbal First Aid Essential series. In part 1, we covered herbs for pain, swelling, and bruising and everyday inflammation. Arnica, turmeric, ginger, and calendula. Research suggests that elderberry can shorten flu-like symptoms when used early. Echinacea can reduce severity at onset, and tea tree oil supports fungal skin environments. Yarrow helps with minor surface bleeding. Conventional medicine overlooks these because symptom-supporting herbs do not fit a pharmaceutical incentive model. Traditionally, elderberry syrup was used for fevers. Echinacea was valued for infections. Tea tree oil was an aboriginal topical antiseptic. Yarrow was named soldier's woundwort. Stay with me, because next I'll show you who should avoid these herbs and a common mistake that reduces effectiveness. Elderberries and Echinacea support early immune signaling. Echinacea's alkaloids modulate innate immunity. Tea tree's terpentine 4-ol disrupts microbial membranes. It kills bacteria and fungi. Yarrow tannis tightens tissue, helps stop bleeding. Modern benefits include shorter sick days, reduced severity, cleaner healing of small wounds, and comfort during mild fungal irritation. Some quick facts. Elderberry, early symptom during support. Echinacea, severity support at onset. Tea tree, topical fungal skin environmental support. Yarrow, minor bleeding and soothing. If this helps, please like and subscribe, and check out my Amazon and eBay storefronts for holistic health. Avoid elderberry during autoimmune flares. Avoid yarrow during pregnancy. Echinacea may be bothersome to those with ragweed allergies. Keep tea tree oil away from the pets. Echinacea can alter liver metabolism. For tea tree oil, tea tree oil must remain topical. Ingestion can be very dangerous. Rapid use. Elderberry, early cold or flu symptoms. Echinacea, scratchy throat onset. Tea tree, toenail fungus environments. Yarrow, shave nits or splinters. Elderberry syrup is typically taken 10 to 30 milliliters 2 to 4 times daily at onset. Echinacea tincture is taken 1 to 2 tea droppers 3 times a day early in symptoms. Tea tree oil is diluted to 5 to 10% for topical use. Yarrow powder can be sprinkled on minor bleeding wounds. Dosing snapshot. Elderberry, 10 to 30 milliliters 2 to 4 times per day. Echinacea, 2 to 4 drops 3 times per day. Tea tree, 5 to 10% dilution, topical, of course. Yarrow, topical powder is needed. The biggest mistakes are taking elderberry too late, ingesting tea tree oil, and taking Echinacea daily for months. Myth 1. Elderberry overstimulates immunity. Fact. It modulates early signaling. Myth 2. Tea tree oil works instantly. Fact. It needs consistent application. Myth 3. Echinacea prevents colds. Fact. It supports severity, not prevention. Elderberry shortens duration. Echinacea reduces severity. And tea tree supports fungal environments. Yarrow supports minor bleeding. Here's the bottom line. These herbs are modest but effective when used early. And do not miss part 3, where we cover stress, sleep, and digestive support. You will find part 3 linked on the screen and in the description. Comment which immune herb has worked best for you. This is healing. This is resilience. This is alternative medicine. As an Amazon and eBay associate, I may earn qualifying purchases at no extra cost to you. These videos are for educational purposes only and are not intended to diagnose, treat, cure, or prevent any condition. Always consult your own licensed healthcare provider before starting any new herbs or supplements.